Hepatitis B is known to affect close to about 2 billion individuals globally, with almost about 400 million people living with a chronic infection, according to the World Health Organization. In Ghana, the prevalence of hepatitis B has been purged around 12.2%, meaning that there are over 4 million Ghanaians who are living with chronic hepatitis B, and majority of these individuals do not know that they have the infection. In recent times, though the data on new infection has improved, but there is also evidence that more people are dying as a result of complications from the hepatitis B infection. And this is mainly because of the silent nature of the disease. When we talk about hepatitis, it is the inflammation of the liver, which may be as a result of several factors. We can have alcohol-induced hepatitis, meaning that high consumption of alcohol can cause hepatitis. We have drug-induced hepatitis when we abuse drugs like paracetamol. They can also cause hepatitis. We have chemical-induced when someone ingests or takes in chemicals like mercury. It can also cause hepatitis. And then we have autoimmune hepatitis when the body begins to eat up the cells of the liver or the hepatocytes. And then we have the viral hepatitis, which are mainly by viruses. With that, we have the hepatitis A, B, C, D, and E. With the A and E, they are mostly through fecal-oral, meaning that they can be transmitted through food and contaminated water. Talking about the B and the C, the B, for instance, can be transmitted through blood and other body fluids like seminal fluid, vaginal fluid. It can be also transmitted mainly from mother to child. And then also when you use sub-objects which have been contaminated, it can get infected with the hepatitis B virus. It can also be contracted through having unprotected sex with an infected person. Talking about hepatitis C, it is mainly transmitted through blood, and especially when you exchange sharp objects with an individual who has been infected with the hep C virus, then you can also get affected. There is a vaccine for hep A, there is a vaccine for hep B, but there is no vaccine for hepatitis C. For hepatitis D, you can only get hepatitis D when you have the hep B. So before you can get hepatitis D, then you must have hep B. This is because the hep D virus, feeds on the B because it's more or less like an incomplete virus, which takes most of its strength from the hepatitis B. So without having hepatitis B, then you cannot get hepatitis D. Let's focus on hepatitis B. Hepatitis B is caused by the hep B virus, and as I said earlier, it is a silent infection, so one can only get to know he or she have the infection when he has done a test, unless maybe there are certain signs and symptoms which may arise and an individual may show. We need to know that close to about 70% of the individuals who get infected with the hep B virus will not show any signs and symptoms. There are two types of the infection. We have the acute infection and then we have the chronic infection. The acute infection means that the disease is less than 6 months old, and studies have shown that children who are about 5 years to adulthood who get exposed to the virus may not even know that they have the disease, and the disease will clear from the body by itself. That is when we say you have an acute infection. If after the 6 months and the disease do not clear as a result of probably a very low immune system, then an individual may tend to have a chronic infection, which means that it has become a lifelong or a lasting infection that the individual may have to live with for the rest of their life. As of now, there isn't any cure for chronic hep B infection. But when you have an acute infection, even without taking any medication, the virus can clear from the body without the individual even knowing. How can one know that he or she has the disease? As I said earlier, we need to understand that hepatitis B can only be diagnosed through a blood test. This is because of the silent nature of the infection. If you are waiting to feel sick before you realize you have the hepatitis B, that will be very difficult because it mimics or takes on other forms or signs and symptoms of other diseases like malaria and flu when you have a respiratory infection. Just like the way you have hepatitis B can also make you feel the same way. So you might be unlikely to get to know that this is the infection you have. So you need to do a blood test for us to diagnose it. How can hepatitis B be transmitted? Hepatitis B is mainly transmitted from mother to child, meaning that when a mother is pregnant and is a B positive, then she can easily pass the virus on to the newborn. That is what we call mother to child transmission. And then we need to also understand that hepatitis B can be transmitted through having an unprotected sex with an infected individual. When you exchange or you are transfused with blood which is infected with the virus, then you can also have the infection. The hepatitis B can also be transmitted when you share toothbrush or other sharp with an individual who has gotten the virus. When you use blade and piercing earrings and those who inject drugs and other things, then you can have the virus. We need to understand that though the virus is said to be found in sweat, saliva, but it is not every body fluid, such as the sweat and the saliva, that can transmit the virus. How is hepatitis B managed? When you test positive to the Hep B virus, it doesn't mean that you are going to die. The complications may set in when you do not know the infection and you don't take or seek early treatment. Once we diagnose hepatitis B early without you developing any complications, then it will require that you can live for the rest of your life without having any issues. You need to realize that after the initial diagnosis with the virus, you may have to do certain laboratory tests like the profile, the liver function test, the viral load, which will help your doctor to decide whether you require treatment or not. Not everybody who has tested positive to the Hep B virus will require antiviral treatment. So after the initial assessment, your doctor may request that after every 6 months or every year, you will come and you will be assessed. Please let us know that once you've tested positive, then it is important that you stay away from herbal concoctions, you stay away from certain medications like antibiotics and paracetamol and other analgesics. Unless they have been prescribed by your doctor, then there will be no need to consume them. You need to also minimize the intake of fat and oil, and then also realize that your food and your friend will be more of fruit and vegetable. When you're Hep B positive, you can eat any food that you like, but always remember that when you are living with the virus, it is causing an inflammation in your liver. So every burden that you put on your liver, like the high consumption of alcohol, will increase the risk at which you develop liver cirrhosis or liver cancer. The signs and symptoms of hepatitis B include loss of appetite, joint pains, abdominal pains, especially on the right side, and in severe cases, an individual may have yellowish eye, the individual may have clay stool, the individual may have Coca-Cola urine. You need to realize that when liver damage occurs, we may have to do several further tests to know the stage of the infection or the damage, and that will advise the next line of action that can be taken. Always remember that when you test positive to hepatitis B, it is not a death sentence, but hepatitis B can be prevented. It can be prevented through vaccination. You take the 3 shots of the vaccine, and that will protect you for the rest of your life from getting the virus. We are always here to help you. You can come to our inbox if you have tested positive to the virus, and we'll be available to give you all the education you need. Remember that hepatitis B is real but can be prevented. Stay blessed.